Good morning, everybody. Welcome to another Geri Short Talk, episode number 3, in which we are going to talk about tube feeding in patients with advanced dementia. I'm Armin Sharakni, Chief of Geriatric Service at Jersey Shore University Medical Center. This is a very common scenario for many older patients and their caregivers, their children, their spouses. Um, they're dealing and they have dealt with an older patient with advanced dementia who have eating problems. This correspondence was published years ago in JAMA on a 93-year-old man with advanced dementia with eating problems. The daughter talks about her experience with her father. She says, more recently he was talking just 1 or 2 spoons or some juice, and then he was pushing it away. He was asking for a drink, and then they gave it to him, and he was pushing the drink away, and nobody could understand what he was doing. Also, he has his IV, he pulls it out. Father, you're going to die, I told him. I know, but I don't want it anymore, he was saying. What a terrible life, I don't want. The daughter continues, I talked to my relatives in Russia and they were doctors, and they said don't do it, because you never do it for yourself like everybody. He's 93, and oh, he had the life that he would have. For me, it would be just so nice to come to see him, and to feel still that I have somebody who could somehow protect me. The daughter continues, in September, all of a sudden he had seizures. He was in the hospital for 4 weeks and he went home, and then in a short amount of time he was back. And they couldn't find anything. He didn't want to eat. He was in terrible condition. I was offered to have a feeding tube at the time because he didn't really want to eat. But he was yelling at me, leave me alone. He was pushing the table. He didn't want to eat. And then when he did it, it was just a little. Then he was moved over to the nursing home, and it was like, I don't know how to say. But little by little, he was eating better and he was drinking better. But if he doesn't want it, he just pushes the food. I can't force him. I can't. Because some people you can do it, but with him, he will tell you how much he loves you, but he wouldn't do it because he doesn't want it. So obviously, one of the horrific experiences of the caregivers is poor oral intake by their loved ones, their parents, their grandparents, especially if they are dealing with advanced dementia. As a result, over the years, there has been a lot of attention to maybe artificial feeding, such as tube feeding in patients with dementia. It even goes back to 1990s. This is a paper on review of evidence on tube feeding in patients with advanced dementia. This was published in 1999, almost 24 years ago. And in their conclusion, they say that we found no data to suggest that tube feeding improves any of these clinically important outcomes, and some data to suggest that it does not. Further, risks are substantial. The widespread practice of tube feeding should be carefully reconsidered, and we believe that for severely demented patients, that practice should be discouraged on clinical grounds. The outcomes that they were looking were aspiration pneumonia, prolonged survival, reducing the risk of pressure ulcers or infection, improving function of that patient, or provide palliation. And as they mentioned, they found no data to suggest that tube feeding improves any of these clinically important outcomes, and it may actually be harmful. This was published in 1999, 24 years ago. There are very few instances in medicine that the data has not changed over the course of decades. In many other instances, with the emergence of the new data and literature, some of these conclusions have changed, but not in the setting of patients with advanced dementia who are being considered for tube feeding. This is a paper that was published in 2021. So 22 years after the first paper that I talked to you about. And this is on efficacy and safety of tube feeding in advanced dementia patients, a systemic review and meta-analysis. They included 12 trials involving close to 1,800 patients. The mean age was 83 years, and there were also 3,800 patients without tube feeding. For mortality rate, patients with advanced dementia with tube feeding were significantly at higher risk for mortality. The odds ratio was 1.79, meaning that patients with tube feeding were almost 80% more likely to die with tube feeding than not without it. And then there was no association found for the risk of pneumonia and pressure sore between groups. However, they did additional analysis, which again showed that patients with advanced dementia and tube feeding were at significantly higher risk of pneumonia. That risk was 3.5 times higher, as well as they were at higher risk for pressure sore. That risk was 2.2 times higher. And also, they did not find any association between tube feeding and survival period of these patients. So once again, a systematic review of many studies have shown no benefit, and in many cases, some association with harm, especially when it comes to issues like pneumonia and pressure sore. They concluded that this meta-analysis indicates that tube feedings is associated with increased mortality rate and possible tube-related complications, and it does not improve overall survival or nutritional status of these patients. The authors suggested that shared decision-making routinely before insertion of a tube between caregivers and physicians are recommended. Because of a couple of decades of very clear and consistent data for not putting tube feeding in patients with advanced dementia, one of items of American Geriatric Society choosing wisely was actually not putting tube feedings in these patients. So in February of 2013, the American Geriatric Society published its first list of 5 things physicians and patients should question. And the first one was, do not recommend tube feeding in patients with advanced dementia. Instead, offer oral assisted feeding. And that is very, very important. There has been times that, with additional support from family members, caregivers, formal or informal assistance from others, patients' oral intake has improved. It is also important that one of the last functions that patients with advanced dementia lose is their ability to feed themselves. So if somebody is losing their ability to feed themselves, it should bring to the attention of their family members, their caregivers, their loved ones, that maybe the terminal event is near. And this is the time that family members, those who love the patient, should reconsider their approach to the patient with advanced dementia. Maybe focus on comfort, maybe focus on being around the patient, supporting the patient, um, enjoying and appreciating every moment of life rather than focusing on artificial means of feeding. Nonetheless, the data over the past few decades have been very, very clear, and the data have been strongly against benefit of tube feeding in this patient population. And as I mentioned, American Geriatric Society strongly recommends against inserting tube feeding in these patients. This concludes this episode of Geri Short Talk. I hope you enjoy it. Please feel free to reach out with any question or concern. and all the best to all of you.